One of the things doctors and patients are always a little confused about is, what about my blood pressure in this arm? No, what about my blood pressure in this arm? And the fact of the matter is, what makes a difference and what doesn't make a difference? And somebody finally did a study, and they said consistency of blood pressure differences between the left and right arms, and they said it doesn't make any difference. As a matter of fact, if you measure, and I believe that, I've always believed that, no one study proves a point absolutely beyond controversy, but this one has the ring of truth. The inter-arm blood pressure difference was consistent only when obstructive arterial disease was present, and that's pretty uncommon. Not unheard of, but uncommon. So the differences between the two arms tends to be which one you record first, because patients, a blood pressure can change within 15 seconds and can change significantly in 15 seconds. So if you take it over here as the first blood pressure and the patient's uptight, by the time you finish that, they're thinking, oh, that's over, thank goodness, and they're starting to relax. By the time you get over here, it'll be lower, but it would also be lower over here. So the point is, don't make a big deal out of it. Now, for all you people on Preventive, Prilosec on a regular basis, and I think I've told you this little pearl, if you have the flu, what I tell all my patients is calm that stomach down, take Prilosec over the counter, Prilosec OTC, and take 2 twice a day, which is above the dose that they recommend. And what that does is it shuts the activity of the stomach down so that when you have the flu and you have the diarrhea or the vomiting, that really sort of stops that production of stomach contents and makes you infinitely more comfortable and helps you get better faster. Long-term use of Prevacid, Nexium, Protonix is associated with an increased risk of fracture of the hip. And I take that pretty much to be the truth. Now, people talk about various supplements, and here was a study about xanthine oxidase and so on and so on. I remember, I knew a very famous cardiovascular surgeon. I just kind of met him at the American College of Cardiology, which I'll be going to at the end of this month, the end of March. It is in New Orleans, and I have mixed feelings about going there, but clearly the American College of Cardiology is interested in sacrificing us, helping us to go down there to help New Orleans. I am a little bit worried. The crime that is going rampant in New Orleans. Of course, crime is rampant in Washington, D.C., and I watched news the other night, and apparently crime, for the first time nationally, has sort of taken a turn up of late. Cincinnati, who would think Cincinnati, Ohio? Cincinnati, Ohio, they had a woman on there who commented that crime had just escalated out of control. I think that was on CBS News the other night. But Dudley Johnson, whom I met, who was a big-time surgeon, he was like one of the people who was doing hundreds upon hundreds of coronary artery and heart valve replacement surgeries. He was from Minnesota. The famous places were like the Cleveland Clinic and the Mayo Clinic and Dudley Johnson up at the University of Minnesota. So he said he never operated on a patient who was not on allopurinol because allopurinol lowers uric acid. Well, not many doctors pay a whole lot of attention to uric acid, but uric acid actually is a chemical in the blood that comes from eating animal protein mostly. It comes from taking water pills. It comes from being overweight. Those are the main causes to kidney disease. Those are the main causes for sending uric acid up. URIC acid, uric acid. And so you give this medication, allopurinol, which inhibits the formation of uric acid, lowers the uric acid, and he said that reduced his complications at open heart surgery. Well, just recently I read an article that I had been unfamiliar with this concept, that uric acid also in and of itself is a chemical that raises blood pressure. No, the two do not coexist. It is a fact of cause and effect relationship. The higher your uric acid, the more your blood pressure goes up. And I would have intuitively not thought that to be true, because what raises the uric acid is generally some abnormality of the kidneys, and also, like I told you, that high animal protein intake, and maybe that's what raised the blood pressure. Well, regardless, they found that by giving this medication, allopurinol, and changing nothing else, that the blood pressure went down. So that is in the FYI. Let's see, what here? Treatment? Okay.